Hi, everybody. My name is Natasha Frost, and I'm a senior staff attorney at the Public Health Law Center. The Public Health Law Center is located at Mitchell-Hamlin School of Law, which is in St. Paul, Minnesota. And we work on a variety of public health topics through the policy and legal lenses. We work through the legal technical assistance model. So what that means is we work on legal research, which is the process of identifying a topic. For example, we'll go over a lot of legal research that we completed today as part of visualizing the policy environment for childcare. We work on policy development, implementation, and defense. Some of those opportunities include a role in working with state agencies related to policy development in the childcare realm, or local level policy implementation for other things related to healthy food, active transportation, or tobacco control efforts. We have a variety of publications on our website. We do trainings like today's webinar. What we don't do is direct representation or lobbying. One of the important frames that we work through is we look through the lens of equity. So in this visualization, you can see that equality is where everyone seems to start off from the same spot, but they don't end or have the same race. And this is especially important on looking through the equity lens when it comes to policy. Policy is a really important lever to help pursue equity, and specifically health equity. And it's through this lens that we actually identified the topic of childcare and the food environment to identify how the policy is really being used to promote health equity and nutrition in childcare. So, specific to today's presentation, we're talking about our project related to mapping the policy environment using the food as a frame. So we specifically focused on Minnesota childcare environment. We're really aware that every state has a very different childcare policy environment, and that policy is actually implemented in very different ways, even within a specific state. So we wanted to look at the reason we wanted to do this is we identified a problem in Minnesota where there's a lot of different areas of focus in the childcare environment. And so we wanted to help identify a tool that would help streamline efforts and really pool the resources so that we can focus on how to align those systems. We were really lucky to work on this project through a Healthy Eating Research Grant and actually through our phase 1 part of the project. And phase 2, which I'll speak about in a moment, was generously funded by Blue Cross Blue Shield of Minnesota, the Center for Prevention. So in the state of Minnesota, which we do a lot of work, we work a lot in public health, and what we identified is that the public health environment is very different than the state of the early care and education environment. There's lots of overlap, but there were a lot of other people that weren't traditional public health stakeholders that were trying to impact quality and safety and a variety of other things in the childcare environment. And this is just a few of the people that we identified that were working in this space. So we knew that we wanted to streamline these efforts, or at least provide a visualization for the various actors and policies that impacted the childcare environment. And so we came up with a process and protocol, and this is a list of how we did that. We started by interviewing key informants in the early care and education field. So we really focused on a discussion and a list of questions for those experts, trying to figure out how their organization, what role they played in the child care environment, and it was specific to the food environment. And we also wanted to focus specifically on licensed childcare because it gave us an opportunity to talk to a lot of state agencies. What we then did is took that information and we analyzed the relationships that were identified in these key informant interviews, looked at the legal requirements that were actually either codified or put into law or policy, so things like statutes or regulations, and then finally identified some of the programmatic standards at the state level, the agency level, and trying to identify what those programmatic standards were. So we put that all together and then kind of went into our phase 1, which was ground testing, and then phase 2. Again, we'll talk about those more in a minute. But what I wanted to share is that as we gathered all of the key informant interview information, this is what we came up with. And we worked really hard to try and capture What these key informant interviews were saying were the relationships. We talked to a lot of folks at state agencies in Minnesota, and there was a lot of information that was gathered from those key informant interviews, and we are very grateful for those key informant interviews for helping us gather this information. But this sort of chart was not very helpful. In fact, many of you who have heard me present on this information before, I know that I lovingly called it the hot mess project because it was so complicated and convoluted, and trying to identify relationships was very difficult. So we needed a frame to identify what the themes were in the information, even though we were specifically looking at the food environment. And we identified the CDC's spectrum of opportunities. This provided us an existing framework for identifying the policy environment, and it was readily recognizable by many of the advocates who had worked with CDC and with other childcare advocates. And so as you can see here, we focused on the different levels of intervention through the policies, and even though it was broader than nutrition, so it identified things like physical activity and screen time. And it was actually broader than policies specifically because it talked about systems and practices as well. We thought it was a good starting place. So our next step was to try and put it down on paper. So as you saw, the very confusing whiteboard mess, we identified what we called the anchor bubbles. And those were the federal, state, and local agencies and nonprofit agencies that truly impacted the childcare environment. And these were the kind of anchor bubbles that we came up with in our first iteration of the project. We then started to draw the lines of connectivity to identify how those agencies fit together. And so using some of these themes from the spectrum of opportunities, as you can see here, we looked at licensing and administrative regulations. We started here first because it seemed like the easiest way to visually represent the policy environment. Another fairly easy way to do that was through the Child and Adult Food Care Program, which is pictured here. And QRIS, or Quality Rating and Improvement Systems, was also a fairly easy way to visualize the information that we were looking to in the project. But what we found pretty early on was that not all of the levers were distinct. So it was hard to find how to draw things like funding and finance, which actually impacted some of the other things we had already looked at. For example, the Child and Adult Food Care Program was really reliant on funding and finance. But we took a stab at using this because it was an experiment and we were trying to learn, and because we were dedicated to that learning process. Technical assistance was another one of those spectrum of opportunity policies that was really hard to have as its own standalone tab. But we did our best and put it together in the format of the visualization. And then it got really complicated because not all of the spectrum of opportunities were really meaningful when speaking about a state level policy lens. For example, facility level interventions and family engagement were difficult to actually link specifically to state policy or state agency work. And then finally, what we found through the spectrum of opportunities is that not all the levers were distinct enough and required a lot more explanation. For example, we found it difficult to figure out how the pre-service and professional development, while an amazing frame for the spectrum of opportunities in this iteration of that experiment, it was hard to figure out how to actually visualize the policy levers. And the same held true for access to healthy environments. So we moved to phase 2. We had actually put together a startings of a visualization thanks to our Healthy Eating Research Grant. And with the generous funding from Blue Cross Blue Shield, we actually took that information and started the truth testing process with advocates. So we took this sort of PDF and we realized after discussing these this level of visualization that a web-based visualization was going to be much more helpful and engaging and dynamic than having it on a PDF version. So from that information, we started to transition it into the website that is listed here, that is now live. And we also found that those levers that weren't distinct or were hard to actually put through the spectrum of opportunities, that we were not going to invest the level of kind of drawing on the website or transitioning that to the website. And so we focused in on licensing and administrative regulation, funded programs, which included CACFP as well as funding and finance, as well as quality measures. We have a kind of placeholder for emerging opportunities for other opportunities as we move forward with the webpage. So this is what it looks like now based on our truth testing. And so you can see that it is much different. We have, this is an interactive website that has the lines with arrows, and that was very important. We also changed how we did the different levels of government. We have, as you can see in the middle here, we have what we call pop-up bubbles that when you click, when you hover over a line, it actually has the specific information of the relationship. We also have specific data pages. As you can see here, we have things like under quality measures, we have accreditation, the child care overview in Minnesota, as well as a series of other data pages that go into a very long, detailed set of information that's specific to Minnesota. One of the things that we found really helpful for this is that it allowed for people who wanted just general information to be able to gather general information from the lines and the relationships of a particular tab. So for quality measures in Minnesota, which is what this is referring to, you can see how the federal policies impact the state, both legislative and the executive agencies, as well as how they flow down through the local programs and to the provider and children and families. And so if you want just a very general information of who and what is involved, then you can look at this part of the webpage. If you want more detail of those interactions, you can click on some of those lines and have that kind of pop-up bubble with the information. And then finally, if you have specific information, for example, on Child Care Aware of Minnesota, you can click on those data pages. One of the things that we found from our truth testing process was that this level of engagement with the information was really helpful depending on who was looking at the website. So we had very basic advocates who were just trying to get their head wrapped around who the players were, who needed just that very basic information that was at the kind of the basic web page. But then there were people who were really interested in diving in to details and through the numbers and through what the actual legal analysis was. And those are who we created those data pages for. So one of the things that we found after the initial kind of truth testing process was that we only had mapped a small part of the process. We had only looked at, in the beginning, we only looked at family child care providers, and we wanted to expand up to the existing components to family, friend, and neighbor care, as well as child care centers. We also realized through our truth testing that we were missing a lot of components. For example, the ECFE was not included, our voluntary pre-K program in Minnesota was not included, Head Start and other key funding pieces for the early care and education environment were not included. We also found that the role of tribes and tribal nations in the initial way that we had gathered the information, it was really important for us to make sure that information was included, and we've sought additional assistance on how to expand that information. And then finally, moving forward, how do we focus this sort of policy visualization within the larger context of the whole child and social determinants of health? So based on those key pieces, we did more truth testing so that as part of that, and we have included additional information. So this is just an example of the ECFE additional information that we added in December of 2017. We were able to actually identify different ways that various tribes are included in the funding streams, as well as in the implementation of programs. We are looking for opportunities to further update our work on how tribal nations are actually visualized in this process. One thing that was really important to us from the very beginning was to have a visual depiction of the sovereignty of tribes. And after reaching out and having some key informant interviews related to how we did that, we've realized that this actually still creates the assumption that all tribes have the same sovereign structure. And so figuring out how to visualize how each individual tribe fits into this visualization is an important way forward. So our key takeaways, and I think this is the most important thing kind of moving forward, was just the process that we identified of actually visualizing policy. It was not an easy process. We went through a lot of experimentation. And so really want to focus on the key takeaways for folks on the call today. One of the things that we realized right away was that key informant interviews are great. They are wonderful for trying to figure out what people perceive their roles are in state agencies, or what they understand the regulations or the statutes to say. But we found pretty early on that actually going back to the legal analysis itself was really critical. And so starting with that legal analysis, framing it within what does the statutes, the federal and federal laws, including regulations, say, what does the state laws and regulations say, as a framework is really important. We also found, very obvious things like recording interviews so you can go back as people kind of come and go in state agency positions, making sure that we had recorded interviews so that we can have kind of a placeholder for that information if we had questions. That layering process, which we are still on the journey to try and layer the information for various users of the information. So people who want just very basic information, making sure that that was available to them and they were not buried in the details from the very start. One of the things that we found as critical and is applicable for any visualization process is you have to have something for people to react to. We had this idea about the visualization, but before we got it onto a paper, it was really hard for people to think about how to make it better or how to even create it from the start. So having something for people to react to was really critical. Once we got that initial PDF, even though it was rudimentary, we found a lot of errors in it in the sense that it just didn't work, our framework didn't work, still continuing to the end to make sure it got done and that then we could use it as the truth testing process to get us to the next level was really important. So kind of staying the course and actually completing that visualization so you could get the feedback was really, really an important lesson. So this kind of idea of the separating hearsay, and what I mean by that is that we heard a lot of things during our key informant interviews that it wasn't accurate. And so one of the things that we identified was that people were interpreting regulations in a particular way, but honestly, sometimes they just truly misunderstood what another state agency was supposed to be doing or was doing. And then finally, while we focused on the legal analysis as our phase 2, it was really clear that contracts and reports were also a critical part of the policy lens and the policy environment. And so in thinking about, for example, the way that our QRIS system is run in Minnesota, one of the ways that we could get further information was understanding the contractual obligations with a nonprofit who is actually taking the lead on running that QRIS program or aspects of the QRIS program. And so figuring out how to get a hold of those contracts to understand rights and responsibilities and standards in place was a really important lesson for us. So as far as content, one of the things that we found as a true limitation from our end is that the mapping of the appropriations was the single hardest part of the way that we were, as soon as we mapped the appropriations process, we were unable to, it was old as soon as we got it on the piece of paper. State appropriations changes every year. It's a very vibrant part of the child care environment. And so thinking strategically about how to put that information on a static website was a challenge that we are still trying to identify opportunities to really have the right information for folks. And again, we've identified a kind of a fix for the short term, which is this idea of a kind of layered system. And so we can update our data pages as information changes, but ongoing funding is needed in order to make sure that that information is current. Another thing about the content, as I already talked about, was this disconnect between the hearsay and reality. So we had information that was provided to us as key informant interviews by experts in the field who interpreted the state agency rules one way, and unfortunately, either the law or other people in that same agency interpreted it another way. And so thinking about how to really lean in and dig into how things are really working is a really useful part of the process. And I think the things that we're still involved in is we are currently actually in the middle of another truth testing opportunity with our experts in Minnesota, and constantly going back for feedback to identify where those gaps are, where the misinformation is at, and where the opportunities for further clarification are really important from a state agency perspective. We found that this tool actually identified several opportunities for further clarification from state agencies. The other one that we identified is that the Office of Early Learning, which was a critical part of our way of framing the childcare environment and the work that was being done, actually is not currently in operation. And so as you have a static web page, the web page actually made an opportunity to actually not be static. It can be a useful tool for updates and ongoing updates. But one of the things that we found from a content perspective is that as agencies change, as governments change, as the people in the executive agency, the positions of power transitioned, the names actually changed. And so the Office of Early Learning is currently not is not currently in the same role that it was when we started our project. And so just thinking about how that is going to be put onto a web page is really important. But the final kind of key takeaway was that whenever we've rolled out this information, there has been incredible enthusiasm about trying to at least have a starting place, just a starting place. This is not this visualization will not solve the confusion and the policy environment in the field of childcare in Minnesota. That is not its role. But what it can help do is peel back some layers. And so there's a continued report of need for that layered approach for the information, but also to just use this tool in the kind of ongoing advocacy to try and streamline and get people on the same page. So I just wanted to point out a couple things that those key takeaways. So for example, one of the key takeaways I mentioned was that there was this disconnect between the information that was reported in our key informant interviews and what we found in the law. And this is, you think, oh, very minor information. Actually, it was pretty significant. So for example, in Minnesota, when it comes to the licensing, the food safety requirements for a licensed family child care provider, our key informant interview information reported that all family child care providers had to follow the food safety code and commercial kitchen licensing requirements. And so that information was inaccurate. They are actually, there's a limited food safety requirements for family child care, which makes practical sense given the fact that family child care are preparing food in a home and so don't have the same sort of access to commercial kitchen or other kind of food safety kind of equipment that somebody in a center or in a restaurant might have. But this was an important identification of a disconnect of information. And so that's where that key takeaway of really going back to the law and backing up the information from the key informant interviews within a regulation. And we found that it was really helpful to actually have the citation for the rule because that was a misinformation that was being distributed not just from that key informant interview, but was actually in the field in Minnesota. I just want to go back to the idea that equity was at the core of this information. We focused on family childcare because in Minnesota, like many communities around the country, family childcare providers are dropping from the licensing roles. And so we wanted to make sure that there was a greater understanding of the opportunities and ways to support family child care providers through the food environment. We learned pretty early on that one of the things was a community resource issue, which is why our expanded version really focused in on funding streams that were available to child care providers. And so as you embark on these opportunities in your own states, I would really recommend thinking about how the funding, technical support, and training opportunities through professionalization actually are codified and supported through policy that go beyond just nutrition. Because if you don't have robust and supported providers themselves, you're not going to have good food environments. And so it really is all tied to the funding and resources to the community of providers, whether that be in rural areas or in urban areas. It's really important to have that as the core of the analysis if you're working on policy visualization. So as part of this, we see this project as a journey. We've linked our other early care and education resources into the visualization process. For example, again, through another generous grant from the Healthy Eating Research Project, we've collaborated with the Harvard School of Public Health and Johns Hopkins with researchers Dr. Angie Craddock and Dr. Sarah Benjamin Nealon to identify a mapping project for childcare regulation. It's located at this URL, and it actually identifies the different regulations on a variety of nutrition standards, screen time standards, and active play standards. For example, this is a map of the different regulations in each of the states that specifically link nutrition standards to the CACFP program for childcare centers. This information, again, is at the URL at the bottom there. We've also identified specifically through the work on this project, as well as another one funded through the Robert Wood Johnson Foundation, that family childcare and quality is something that we need to be really thinking strategically about and supporting family childcare providers. And based on that information that we've gathered through a series of research and key informant interviews, we identified 2 resources, as well as we have an unpublished report that is available. If you're interested in that report, you can email me and I can send you a copy of that. And then finally, we have a series of resources that we're collecting, both our own resources as well as links to other key resources specific to childcare and healthy childcare. And this is the map. Again, the URL is listed at the top. And we have on each of those state web pages specific information related to the screen time standards, information related to definitions and exemptions, as you can see there in the middle of the screen. That's really important because how each of the states defines childcare and who it exempts out is really critical. It's all over the board. We've actually just put all of that information in a fairly large Excel spreadsheet. Again, it's on the webpage there. Or if you have difficulty locating it, please feel free to email me. In addition, we have links to childcare regulations and other resources on each of these pages. The regulations that we have linked on our webpage is actually part of the highlighting project, which helped as the entry point for the Public Health Law Center's work in childcare, again, funded through Healthy Eating Research. And one of the information, or one of the pieces of that, is that we have the regulations highlighted so that you can actually easily identify the different regulations specific to food, physical activity, screen time, and other key public health components. Like this is the color coding for the highlighted project. And finally, childcare research and childcare policy is complicated. It's very state specific. And so if you need further information, are looking for resources on our website and can't find what you need, or are interested in joining a great group of researchers through a group of early childhood working group that's run by NOPRIN and HER, please email me and let me know, and I'm happy to connect you to those resources or that work group. And with that, I will open it up to questions. Okay, I'm just going to be reading the questions. All right, so the question is the website multi-user with opportunities for individual childcare centers to input the information and connections into the big picture? The answer is no. One of the limitations with the visualization is that it's specific to Minnesota, and it's not interactive in the sense that people can input information. We are using that limitation as a guide to think strategically with our partners in Minnesota about how else can we start mapping other things. So we've undertaken this project to map the policy and regulatory environment. But there's a lot of other really important components to supporting childcare providers, like professional development or technical assistance that's on that spectrum of opportunities from CDC. It's harder to do that through policy mapping, but is there another opportunity for mapping that's available? One of the things we've identified as part of that family childcare research is there's some great work that's being done to help pull that information together in other states. And so again, if you're interested in other resources that are being developed by some leaders in the field that we identified as part of that project, feel free to email me and I'll send you that unpublished report. Question is, how will the mapping and website be sustained for timelines and updates after grants expire? Great question. I don't have an answer to that other than to say that we are, one of the benefits of doing this in a state that we have ongoing contracts. For example, we have an ongoing contract with Blue Cross Blue Shield of Minnesota. And so thinking strategically about how updating the map will help further their efforts to promote equity in the childcare environment under their existing funding streams and grants is going to be a really critical ongoing conversation. But I do think that there is an important lesson about how to map each state's policy environment and ensuring that that information is updated. As I mentioned, appropriations changes every year. And so if the, I guess our mantra is that if it's useful enough, the funding to actually support the ongoing work will come through. And we found that in Minnesota, the important kind of getting everyone level set with what the policies actually say is so critical that we believe that that will further the funding streams in the future, and that we just have to continue to ensure that that message is being provided to others. The question is, are states beyond Minnesota applying the mapping in their state, and what are the best practices of translating the work from Minnesota? It's a great question. One of the things, that's where I went with the key takeaways. I think there's a way to do this in other states, and we really struggled with, do we create a tool that other states can use to start to map this project? And I think one of the threshold questions to ask the state before you even embark upon mapping the policy environment is it needed? I know one of my, the people that I always go to as a thought leader, Krista Scott with Child Care Aware of America, and identifying whether or not, and we had this conversation of the state needs to identify whether or not there's enough confusion in that state with key advocates about the policy environment, because if there's not confusion, there's no need to create kind of a level setting tool where everyone can get on the same page. And so really asking that question first. Is there enough confusion about the policy environment that it requires some level of investment of time and energy and resources to map the policy environment? And if the answer is yes, there's enough confusion, really thinking about partnering with a legal services organization that can help identify the legal words on the page, the regulations, the statutes, and how they interact with each other is really important. Just doing key informant interviews is not as useful unless you're involved with those policy wonks or the people who are writing the regulations at the state level. And so I think to get that conversation started, I'm really interested in thinking strategically about that with others. I'm happy to provide, spot technical assistance. The Public Health Law Center is looking for opportunities to partner with other states that are interested in doing the same sort of policy mapping tool, you know, either at the micro level, so maybe not building a website, but maybe on a more report-based or a more kind of static version of that, we're happy to, you know, talk and work through those sorts of questions with the individual states. One of the things that's really important and that we learned, was working with the experts in the state, working with the state agency leaders who are writing those regulations, who are implementing those regulations. It was really critical for us to be talking to those folks and identifying where those gaps were. All right, so the question is, I'm just going to read it. I am currently a researcher performing key informant interviews. We are having trouble visually displaying the relationships between state agencies, such as the health department and with other departments. Do you have any advice on how to map relationships between groups, daycare centers, state agencies, nonprofits? One of the thing that we found really important was to just start somewhere. So putting it down on paper, and it doesn't have to be on a website. You can literally just draw it out. So that's where we started on that, the dry erase board. And the way that worked for us, because we're attorneys, was thinking about the relationships from the federal level to then the state legislative branch, then the state executive branch, because those are two different levels of government. And then how those are then they interact with nonprofits at the state or local level, and then how they work with local governments. And then having the provider and the child family relationship kind of at that end. So that really worked for us. I'm going to get back to the way that we visualized it for folks to see. So, so you can see that the tribes and the federal government are on one side, and then it goes through to the provider and child and families. And having this as like the anchor bubbles, so taking away all those lines, was a really important start, and you could just start drawing the relationships. And when you go into your key informant interviews, to actually say, hey, how does this work? And you could use our website to actually make sure that you use your own state's agencies. And it could just be a fill in the blank for them. But you can use this as a guide for that, because one of the things the state agency kind of representatives that did key informant interviews, they had aha moments after we showed this to them, not because they didn't know the relationships, because they didn't visualize it in their heads and they couldn't put it into words in the same way that they could do when they drew it on the piece of paper. So bringing a piece of paper into your key informant interviews, or having some interactive way if you're doing it by phone, is really important. The other just really technical thing, like ticky-tack thing, is we used technology. So we would draw it out, take a picture, send it to the person we were talking to on the phone. They would literally draw it out, take a picture, send it back. So it was a real interactive process in that way. Okay, are there any other questions? All right, well, I would really, I'm going to get to the end slide here. I'd really like to thank everybody who has helped us through the process. I mean, obviously, Healthy Eating Research has been a leader in the area of early care and education, and the investment and commitment of Blue Cross Blue Shield of Minnesota to really bring this visualization to life on our webpage was critical. And we hope to identify opportunities in the future for how to expand this into other states, or at least just provide support and maybe even just, emotional support and cheerleading for other states to really think how policy interacts with some of these really hard questions of nutrition in the childcare setting. We do have one last question, and that is how we identified the key informant interviews. That is really interesting. We at the beginning worked to identify the key agencies that were on our visualization and went to the heads of those agencies. So we really focused on state level government, and they actually were able to identify the linkages with the federal government and how it interplayed with our state structure. And then from those initial the initial rounds of key informant interviews, we actually identified another round of key informant interviews. So I am a lawyer. My colleague in this project, Anna Ayers-Luby, who is now off at medical school pursuing a degree to be an MD, she was able to use her researcher terms to, like, I'm sure there's a fancy researcher word on how you identify that second round. But I think that was really important, was to not get the whole list of key informant interviews from the very beginning. We identified the obvious ones, so the people at the state agency who implemented child and adult care food program, the people who were implementing licensing for family child care providers. You know, those were critical people who we needed to talk to for key informants. And then from that, we identified other folks through those key informant interviews. And so that was really important to leave that latitude. The other thing that is important when thinking about key informant interviews, people that we need to talk to more are people who are in the different tribes in Minnesota, to see how the tribes or tribal nations in Minnesota fit into the visualization. That's going to be a really important process moving forward as funding permits, as well as the providers themselves. We are doing some provider information sessions to identify how providers feel the information captures what they're experiencing and what gaps there are in that information. Because providers, families, and children often are really feeling the impacts of the policies, but they are not always included in the key informant interview process. And so those two are the ones that we didn't have as many opportunities for key informant in the beginning, but really see a value in kind of in the rearview mirror, the retrospective. All right, with that, I would like to thank you for participating in today's webinar. Again, please email me, call me. If you have any questions, we'd love to share this information so that folks can use it and in their own states and research. Thank you.